How do doctors biopsy a suspicious mole for melanoma? When a mole looks unusual or changes over time, doctors need to find out if it is melanoma or just a harmless mole. The process starts with a careful examination using the Biopsy criteria, which looks at whether the mole is asymmetrical, has irregular borders, multiple colors, is larger than 6 millimeters, or has changed recently. If the doctor suspects melanoma, they will recommend a biopsy to get a definitive answer. Before the procedure, the doctor cleans the area with an antiseptic to prevent infection. They then inject a local anesthetic, usually lidocaine, into the skin around the mole. This numbs the area so the patient feels little to no pain during the biopsy. The injection might cause a brief sting or burning sensation, but it lasts only a few seconds. Once the area is numb, the doctor chooses the most appropriate biopsy type based on the size and location of the mole. The most common method is an excisional biopsy, where the entire mole and a tiny margin of surrounding normal skin are cut out with a scalpel. This method allows the pathologist to examine the full depth of the lesion, which is crucial for staging melanoma. The wound is then closed with stitches, which may be removed after a few days. For smaller or hard-to-reach areas, a punch biopsy might be used. This involves a circular blade that removes a small, full-thickness piece of skin, including deeper layers. Sometimes, a shave biopsy is performed, where only the top layers of skin are shaved off, but this is less common for suspected melanoma because it may not provide enough information about the depth of the lesion. After the tissue is removed, the doctor covers the site with a bandage. The sample is sent to a dermatologist, a specialist trained to look at skin tissue under a microscope. The pathologist checks for cancer cells, measures how deep the melanoma has invaded, and looks for features like ulceration that can influence prognosis. The results usually come back within a few days to a week. If melanoma is confirmed, additional tests may be needed to see if the cancer has spread beyond the skin. Treatment plans are then tailored based on the stage and characteristics of the melanoma. It is important to remember that biopsy procedures are safe, quick, and essential for accurate diagnosis. They help distinguish dangerous melanoma from benign moles, guiding effective treatment and helping protect skin health. Always consult a healthcare professional if you notice any suspicious skin changes, as early detection is key to successful management.